I think one of the things that we started to really think about when we saw the opportunity of the grant was the possibility of really taking our patient and family-centered care behavioral expectations and evolving them into something that would be much more real. And so as we thought about it, how is it that we really demonstrate behavioral expectations around patient and family-centered care?
Hi, Mark.
Hi.
My name's Kathy. I'm one of the RNs that will help get you ready today. So what are we doing for you?
The organization has really developed these standards, and we put them out to all of our staff. And so this year we're supposed to evaluate them. And the question was, so how are we really going to do that? What does it look like? And so when we talk about behavioral expectations of wearing your name tag, things like treating each other with respect and dignity, involving the family in decision making, how do we know when we've really done those things? And so we're developing a curriculum. We will be using the family advisors to really actually be the patients in our simulated environment through our patient safety training center, where we will be able to have our experienced nurse orientation go through using the information that they will learn in their program about what it means to be patient and family centered.
And so there are certain of the behaviors that they've defined, such as always wearing a name tag, or always introducing oneself to a patient and describing why you're there and what the nature of the interaction is going to be. Those are actually measurable and can be observed. In order to develop our culture in such a way that these just happen automatically, it's going to require effective communication and training of these things. And this is where our simulation center comes into play.
And so we're going to be using the patient family advisors, those individuals who are patients and our family members who have had some interaction in our local healthcare system, are coming together with us to say, let us help you define what this really looks like.
There are 3 of us that are patient family advisors on the team that's working on the simulation scenarios to advance the awareness of patient family-centered care and the always events that just need to be embedded at every level of the hospital.
The Simulation Center is a very technically sophisticated place wherein we can do some really exciting kinds of simulations of very complex medical procedures, such as a major trauma coming to our emergency room, or a delivery or a surgery. But it's also an observational area in which to do training of people just around behavioral interactions and to help people understand how to do that, whether it's taking a good history or engaging a patient and family, maybe from a diverse cultural background, in a way that actually meets their needs for effective patient and family-centered care.
What we would see in the simulation center would be a patient who was probably one of our patient advisors, and a nurse doing a procedure or going in and having an interaction with the patient. And that again, what we will be looking for in that experience is not only the technical parts of it, but how well did that person interact with the patient. Then after it's over, then there would be a debriefing, and the advisor would also be the individual who would be providing feedback to the staff. How did it feel? What did you do that made me feel really included? How did it feel like when you didn't say what you were about to do, etc.?
So I guess that's our role, serving on this committee, is to help create the scenarios that will be used. What does patient family-centered care look like, and what doesn't it look like? And we have lots and lots of real stories that we can help make it real.
I think the most important thing, though, is that this is not unique to nursing, but what we would want to have happen is that through our curriculum development, that we could embed the patient and family-centered behaviors in all of our simulated experiences. And so we believe that's a real important deliverable that will help us change the culture of our organizations as our staff go through the simulation center. So again, if we can contribute to that change in culture in some small way, that would be dynamite.
To be striving towards always events which avoid those negatives as much as possible is an enormous task, and one I'm so glad the institution is taking seriously and really rising to get better at. I see the culture changing. That's tremendously empowering to want to keep at it. And if being the messenger of the patient and family experience back to people that can drive change helps, that's just a really awesome opportunity, and it's a privilege.